This is an instructional video on how to navigate through Lippincott Advisor. In order to access this resource from home, you will need to sign into SJ Access, and then you will access the SGen homepage or the intranet. You're going to click on the Reference tab at the top of the page, open the Libraries tab, and then you'll click on Electronic Resources, and then Databases and Collections. These are listed alphabetically, so you're going to click on L for Lippincott Advisor, and then you're going to open the Lippincott Advisor tab. You'll be using this resource while completing your CPGs this semester. As you can see on my screen, there are different tabs, and including clinical diagnosis and treatment, care planning, patient teaching, quality and safety, leadership, and additional resources. I'm going to review some of the commonly used tabs here. So the first thing I'm going to show you is diseases and conditions. So this is where you're going to look up your patient's admitting diagnosis, any of their medical surgical history, and this information will be used for your CPG concept map. So let's say you're working on your concept map for a patient who was admitted with pneumonia. You can look under either adult diseases and conditions, or you can go to the top and click P, scroll down, and you'll find pneumonia. When you open this up, it's going to give you a lot of information, including overview, pathophysiology, different causes or etiology, risk factors, history, assessment findings, diagnostic test results, treatment, and nursing considerations such as interventions and monitoring. Okay, so that's most of the information that you'll be using for your concept map. Another resource is the Signs and Symptoms tab, which if you're doing an assessment on your patient and you notice something abnormal, all of these are symptoms that your patients may experience. So let's say, for example, your patient has a cough. You would click on C for cough, and it's listed here. So we'll say the patient had a productive cough, and it gives you information that you need to know. Overview, some cautions, history, physical assessment, some potential etiologies of a cough, and then the treatment and nursing considerations. Another tab that I'll show you is Diagnostic Tests. So your patient on clinical, you'll be looking up your laboratory tests. So they are listed here on the side in this column, or you can look at them alphabetically. So let's say your patient had a potassium level drawn. You can go click on P, potassium level serum. It gives you information about what it is. It gives you information for teaching your patient, some dietary information, some precautions. And the most important thing for this semester is looking at their normal results. And those are listed here. So in class, we're going to be teaching you the laboratory values found in Lippincott Advisor. And those are the ones you're using for your CPG. Under the same tab, under Diagnostic Tests, if your patient goes for a test during this admission, you want to put that in your CPG. So let's say your patient went for a chest x-ray. You click on C, and it's under chest radiography. Gives you a description of the test, purpose, preparation, nursing considerations, and then it gives you information about the interpretation of normal and abnormal results. Another tab that I'll show you is treatments. Treatments are any invasive procedures or surgeries. So if your patient has had surgery on this admission or an invasive procedure, you need to include that in your CPG. So let's say your patient had a hernia repair. You would click on H, and you would look at these. We'll say hiatal hernia. It gives you information, the overview, what it is, gives you information about the procedure, complications, pre-op care, and post-op care, patient teaching. Okay. So a very great resource for your looking up information about surgeries. Another tab that you'll be using is drugs. So you do have the other resource of Micromedics, which is available on the SJCON as well. But Lippincott Advisor also has that information. So they're listed out by class of drugs on this side, and there's a lot. They're also alphabetically here. So I'll just open up one. Let's say you're giving your patient acetaminophen or Tylenol. Gives you information about the therapeutic class, indications, dosing, administration, routes, interactions, contraindications, and nursing considerations and patient teaching. So that information you can use for your medication pages in your CPG. Another thing I want to show you is when you're doing your care plan later in the semester, you can look under problem-based care plans, and these are all listed by concept as well as alphabetically. So you're going to be learning more about nursing diagnoses, but let's say your patient on clinical reports to you that they're having 8 out of 10 pain. You could look under the concept of comfort, and you have the choices of acute pain, chronic pain, or impaired comfort. So we'll click on acute pain, and it gives you your goal and interventions, which if you're using your that diagnosis for your care plan, this gives you interventions that you would be able to use for that. And we'll talk more about that later in the semester. And then you do have information that I won't go over today, but there's patient teaching, quality, safety, leadership. These are all things, if you take the time to look through, you're welcome to. Another resource that I'll show you quick is additional resources or books. And if you look under texts, there's a health library, and there's some really great textbooks available for free that you can look at. So this one's about a physical examination. So when you start learning some of those assessments, you can look at that. These Nursing Made Incredibly Easy books are available. There's a procedures guide, pathophysiology, and then it's all separated out by types of nursing. So critical care, emergency, maternal newborn, med surg, nutrition, and some other specialties that you can look through. So I suggest taking some time to really go through Lippincott Advisor. It's going to help you this semester while you're completing your CPGs. Thank you.